Good afternoon, and welcome to the third episode of the Capitol Hill series, Capitol Hill Day from the Inside. My name is Bradley Coffey, and I'm the Manager of Government Affairs here at the American Alliance of Orthopedic Executives. And I just want to take you through a brief background on what Capitol Hill Day is and why it is that we do it this way. So what is Capitol Hill Day? It's a gathering in the United States Capitol for orthopedic executives to meet and discuss policy with policymakers. This is commonly what is called grassroots advocacy, and it is an opportunity to get constituents to meet with their legislators and push for legislative change. The old days of a lobbyist sitting in a smoke-filled room while the policymaker and the lobbyist discuss changes they want to see over a steak dinner really don't exist anymore. A lot of the change that is created on Capitol Hill is because of this grassroots advocacy. It's because of the constituent themselves. So AAOE's Capitol Hill Day is a safe and effective event through which to influence policy. Your appointments are scheduled for you by staff, myself. Talking points are provided. This is something that the Advocacy Council and myself work on really throughout the summer, is to identify issues that could be of importance to members and then putting together talking points and position statements that can be used for that. As I said, the issues are selected by the Advocacy Council and then approved by the Board of Directors, and we provide training to attendees. This is done over webinar, and it's an opportunity for us to teach you how to get around Capitol Hill to be the most effective and efficient while you are on your visits, and then also to walk through the issues with you, because we know that when it comes to some of the jargon that is used in some of these policy discussions, you may not know all of that, but you certainly know how these policies do end up affecting your practice, and that's why we need you to participate in Capitol Hill Day. So we've gotten quite a few questions about why we've chosen September 10th and 11th for the event itself. The real reason is simply timing. There are a lot of events that are held in DC in the spring when the weather tends to be much more temperate, I would say. That's what they actually call fly-in season. So if you remember from the last webinar, Joel talking about the scariest thing on Capitol Hill is getting stuck behind 150 high school seniors on their class trip. That's when that typically happens, is in the summer. When I visit and I'm behind a bunch of these fly-in groups, it can be quite frustrating for somebody who knows how they're getting in there to be stuck behind a bunch of people who don't know how to get around. So really, this time was chosen to try and prevent some of that. It's also chosen so you don't have to choose between attending the annual conference and Capitol Hill Day. We want you to be able to attend both. We also wanted to keep it clear of the AAOS's National Orthopedic Leadership Conference, which is their fly-in event. So really, again, it just comes down to timing. As far as the schedule goes, from 4 to 5 p.m., we'll have check-in on September the 10th. Then from about 5 to 6:30 p.m., we'll have attendee reception, as well as some education where you'll get to meet the people that you've been partnered up with for your Hill visits, and you can talk about different strategies, who will discuss which issues, all of that fun stuff. And then 6:30, there will be dinner. Then the rest of the night is yourself. It's free. You can go to really see just about anything in DC you want, do the Monuments by Moonlight tour, all kinds of fun stuff. Then Tuesday, September 11th, we will be having breakfast from 7 to 8, and then Capitol Hill visits from 8 a.m. to 5 p.m. Next, I wanted to talk about the location. The Hyatt Regency Washington on Capitol Hill is where the event will be held. This is an extremely close proximity to Capitol Hill. As you can see on the map above, it's about 2.5 blocks away from the Senate side of the Capitol. It is $264 a night. That September, it's right after the August recess, so demand tends to shoot up during that time period. So you can see that the price that's listed on there on this Google Map image is far cheaper. That is not a price that we were able to negotiate. In fact, I think you'd be hard pressed to find a hotel in DC during this time period that would cost that little. So it's very close to DC, good food around a lot of different restaurants, close to metro stations. So you can either walk to the Capitol or you can take the metro. Say if you're going over to the House side and you didn't want to walk, you could take metro, lots of taxis, and you can also do Uber as well. So we try to keep attendees close to Capitol Hill just for the convenience. And we feel like we've secured a very good hotel for that. As far as preparation goes, AAUE will provide education prior to and during the event. As I said, we will provide education on how to navigate Capitol Hill. If you go to aaue.net/Hill-Day and you scroll down to the scroll down on the website just a little bit, you will see some education that we did last year as an example of the kind of education we provide. So that could provide you some samples of what that education is like. Then AAUE will also provide talking points and one-pagers to use during your meetings. Then the mobile app will also be available to you prior to the event, and it will have some helpful information in it, as well as all policy documents, including the talking points and your schedules in there. All you really need to do is show up. It's really that simple. You need to be there and you need to be advocating for these particular issues. So you may be asking, what are the issues? Well, we did cover those on the second webinar, but we'll happily go over those again. The first issue is innovation in total joint care. So many of you may remember that last year CMS did take total knee replacement off of the inpatient only list. However, they failed to add them to the the ambulatory surgery center covered procedures list. This was very disappointing to us. We were very insistent that if one action was taken, that both need to be taken. However, CMS did not agree. So we've been asking members of Congress to support and even write CMS to include all total joint procedures, so total hip, total knee, total shoulder, and I believe ankle in ambulatory surgery covered procedure list. The outpatient prospective payment system was actually just released for 2019, and unfortunately, CMS has not yet included total knee arthroplasty on this list. So this has become a very timely issue. We believe that this is a matter of competition, as well as we say in the title, innovating in total joint care. Value-based payment model design. So many of you may be looking at participating in bundled payments for care improvement advanced. And as you're going through that process, you may have been finding out that there are a lot of things that just don't seem quite right with that program or with that model. So many things, including the 50% cap on physician gain sharing with episode initiators, as well as a couple of other issues that have somehow found their way into this program. We feel that that's a problem. And part of the reason that these things exist in this program is that CMMI and CMS does not put voluntary value-based payment models in front of the public for public and comment rule or notice and comment rulemaking. As we feel that if this were the case, a lot of these issues could be avoided and give more physicians and more groups the opportunity to participate in these models. As we see it now, a lot of what we've been hearing is that a lot of practices will not participate in BPCI Advanced until these issues are fixed. So that there's a bit of concern there that many practices are going to miss out on these things. So we're asking for two things with this. to include a technical expert panel or advisory council on the creation of these payment models, especially to guide CMS on the creation of these payment methodologies, and to put these models before the public during a notice and comment rulemaking period. This gives AAOE and it gives you the opportunity to actually comment on these issues before they're actually impacting a group's reimbursement and before they're actually impacting patient care. So we feel this is also a very timely issue and also a very important issue. This third issue is something that we've been working with some other groups on, including the National Osteoporosis Foundation, but it is about bone densitometry testing. So any practice that's using the DEXA scanners to conduct osteoporosis testing knows that CMS has been required to cut, and it's about half of what is paid at a hospital, but to cut the reimbursement for those scans that are done in a physician's office. This has led to a lot of practices not even being able to cover the cost of the machine, and then even going so far as to stop offering the service and sending patients over to the hospital to get the test done. We feel this is a problem. So we are asking Congress to equalize those payments so that the cost of the machine can be covered through the provision of this service, and to, again, encourage more competition within the healthcare marketplace. And the fourth is one of the oldies but the goodies. It's the physician-owned hospital ban. So if you've been paying any attention to this little thing called the Affordable Care Act, you know that Section 6001 banned the new creation or expansion of physician-owned hospitals. This was part of a broad concern about overutilization of services and improper referrals. So rather than actually working on ways in which they could prevent things like that, they just decided to use the heaviest hammer they could find to outright ban them. So we've been working with other groups in the past to try and overturn this ban. These other groups have included the AAOS, Physician Hospitals of America, as well as several other groups to overturn this ban. And we feel that this year is probably one of the years that it's most likely to happen, especially during the lame duck session right after the election. So we feel it's incredibly important that even if you are not in no way interested in investing in a physician-owned hospital, these entities do increase competition with some of these health systems that go out there and buy up all these smaller practices. So we feel that it's important to nurture the creation of these. And we feel that HHS and the CMS feels the same way. I was present at a hearing last week on the Stark Law, and Sam Johnson, one of the sponsor of the legislation that would repeal this ban, was asking Deputy Secretary Hargan about this. And, the Deputy Secretary said anything that throws up artificial barriers into the marketplace harms competition, and we feel the exact same way. So we feel that now is really the time to be active on this and try to get some momentum behind us. So a little bit about the cost. Registration is $300. You may ask yourself, why are we charging attendees when you can see that we do offer $150 scholarships to all paid registrants? And this is really to make sure people show up. We don't want to have people sign up, then we use AAOE's name and connections on Capitol Hill to get some of these meetings, and then people not show up. It's happened before when we didn't charge, so we were trying to make sure that that does not happen again. Then the hotel, as I've said, is $264 a night, but really the impact on your practice is priceless. This, as I've said multiple times, this is really one of the only ways to make a difference nowadays, is to actually meet with your policymakers, and AAOE has made it super easy for you. there's really just no excuse not to attend, but you have every reason to attend because healthcare is one of the most heavily regulated industries in the country. So that means you've got a lot of issues that you have to deal with as a practice administrator, and we're trying to help you deal with those and make your work life just a little bit easier. So I really hope to see you in Washington, D.C. in September. For more information, you can visit our website at aaoe.net/Hill Day, or you are welcome to email or call me. My email is bcoffee@aaoe.net, or my phone number is area code 317-749-0629. Thank you very much.